As you could tell, this is not polished. This is organic. We welcome you all to our behind the scenes of our hospital facility here in San Pedro. So I'm John. This is Dr. Peters, but you'll hear me call her Madison. Um, and we're both very excited to show you around the center today. Thank you, first off, to everybody for your support, for your words of encouragement, for reaching out with your questions and concern as we experience a mass stranding event due to a toxic algae bloom that is now in its late 8th week. It's now broken the record in terms of length of time as 2023. It's also worse in terms of the number of animals and the health of the animals. So we're going to be showing you animals at different stages of recovery here at the center. Some of them are still in a pretty bad state, comatose. Some are almost ready to go back to the ocean, especially some of our pups. So there are some sad moments that you're going to see, but there's also some joy, doses of joy and doses of hope. That's what we hope you'll walk away with, because you're helping to make sure that every animal possible is rescued, cared for, and as many as we can send back to their ocean home. And it's because of you. And we really extend our thanks during this time. You're part of our family, so you're going to see exactly what this place is like when it's full of animals. We have lots of volunteers and staff here, and I just want to set some of the tone for tonight. We were going to start on the other side of the hospital where our animals are loaded in after being rescued on the beaches. We've had a lot of animals come in today. I think it's up to 7. We also have today. They're still coming in this evening as well. So that area is as they're bringing the animals in. We're going to start in our pool area, but we will go back there, just play it by ear with how this works as we just respond to the needs of the patients and the folks that are still working very hard at 6 o'clock at night, and we'll be here till probably 8 or 9. So with that in mind, Dr. Peters.
Hi. So thanks for joining us.
Let's start with this pool here. This animal is swimming in the bottom of the pool, right?
Yes, this animal has domoic acid. He is still showing some signs of domoic acid, some tremors, but he's being treated with oral medications to try to prevent those neurologic signs, the tremors, the seizures. And so hopefully those are helping, but he's a little bit day to day right now.
Okay, so still guarded prognosis?
Yeah, he's still earlier for that. He's looking brighter now and more with it, but he's definitely not out of the woods at this point.
Okay. Keep asking Dr. Peters questions that hopefully are. You have questions, please use the chat function. Dave Peter, if you want to show him on the camera there, Jamie. Dave is amazing. He knows a whole lot of stuff about a whole lot of stuff and can answer most questions. All means ask, and then we'll check in with him to see what questions you all have as we continue along. But again, this is a male animal. Medication and supply chains during this time. Midazolam using as the main anti-seizure med. Can you talk a little bit about what we've had to deal with on the supply side and what that means for some of our patients?
Yeah, so we have had, over 200 animals strand associated with this algal bloom. And so that takes a lot of medication to treat them. We give midazolam, seizures, and we've been just going patients. These animals are also quite large. Some of the males in particular can be over 400 or 500 pounds, and it requires a lot of drug. So we've been going through it at a very rapid pace, and it's been hard for us to just keep up with our own demands.
We move on to the next pen.
Sure.
While Jamie follows us, there's 3 animals in here. We talk a little bit about how or when they and sort of how they're acting now and sort of what we're seeing in terms of symptoms. And DA again, I believe, yes?
Yes, 3 adults all being treated for DA toxicosis. When they come in, at first they tend to be pretty comatose, very quiet. they start to become a bit more active. These ones, they look a little sleepy now, but they're in for the night. These ones in general are more, these animals are eating and interacting relatively normally with each other for the most. Sometimes the clinical signs associated with domoic acid can wax and wane a little bit, especially with a more chronic form of the disease. So those are things we're monitoring closely for once they are more active and in the pools, is if they are pretty steady in terms of their neurologic state or if their signs are coming and going a bit more.
And we'll talk a little bit about that chronic versus acute. A little bit earlier today when we were walking back here, we would have a couple of these animals charge at the fence, and that sort of aggressive presentation of symptoms. Can you talk a little bit about that and what we're looking for in terms of their behavior before release?
You know, like I mentioned at first, they're figure out what's what. And that can be confusing to them, and it can present as them being aggressive, being guarded and trying to protect themselves when there's a movement nearby or something like that. So it's not that they're attacking so much as they're just confused, and their reactions to people's presence and movement come across as aggressive, but that can be kind of the initial state after they are kind of wake up and start to get it together a little more. They can be hyperactive.
So I think that point about the reacting versus attacking is key, because there's been so many headlines that have gone way too far, in my particular opinion, on the sort of behavior that we're seeing in these animals. And if they are not, if they don't have all of their senses sort of full functioning, when they're in the water and somebody gets close by, they haven't sensed it until it's a fight or flight kind of response, right? So it's sort of same with humans. If someone comes at you unexpectedly, you're going to react. Is that more how you would explain it?
Then we call it hyperesthetic. So hyper stimuli. So even if they're in the pen or in a hallway and we just lightly touch them with the board to assess their reaction, they have like an overreaction to it. It's startling to them because they're disoriented and confused. And so their reaction is even more pronounced than what would be normal.
Okay. Down in here.
It's getting.
So who do we have in here?
So two more adult female in treatment for DA, and similar state, alert and receive their medications that way, but still not quite neurologically ready to go back into the wild.
And then area there, do you know anything about what's he dealing with?
Yes, he was in a different pen earlier today, but then he began to behave more inappropriately, so have more neurologic signs. And we were worried about him having access to a pool overnight. And so we're leaving him out there in the hallway so that he can keep himself safe, really. And we loaded him up on medication to get him through the night.
What was the phrase you used about
Hyperesthetic?
hyperesthetic? That's the term. So he was being hyperesthetic.
He was actually just kind of having seizures.
So, all right.
Well, we just gave it to him. It's hours or so that hopefully by the time he gets his next dose in the morning, it will allow him to be seizure free through the night. That's the goal anyways. So we'll see how he does.
Yeah. To move the bit of in and out on the audio. Zoom problem. Zoom was out most of the day today on a wide scale level. So bear with us.
Yeah.
We'll continue. And then we have, this is medium size, and it looks like we have 5. What's going on?
These are all also because they're more alert and active, and so they can tolerate a larger pool more than each other normally.
So, Jimmy, would it be better to use your phone audio? Or, all right, so we're just gonna have to bear with this, Dave. Yep. Switch to the what? And we just speak up and see. All right, we're gonna try using a different microphone. That's maybe a little bit further away, but I tend to have a loud voice, so hopefully that will. Hopefully, Dr. Peters, I'll ask you to probably project more than you normally do.
Loud.
Okay. Are we on that mic now?
Yeah.
Is it working? Okay, so it seems better. Should I turn this one off, Dave?
Yeah, you don't need that anymore.
Okay. So, sorry, we've got 5 animals in this pool here and all DA females. But,
Yes.
But further along than what we saw in the others or not?
Around the same, maybe some are a bit further, but again, what we're really watching for is whether their signs stay consistent or if they wax and wane a bit. So it changes day to day.
So their body condition looks a lot plumper, more healthy sea lion than say what we saw in the previous pool. So they're eating well, but the neurological symptoms are holding steady. Is that more the issue?
Yeah, and some of them are doing really well and are probably gonna be able to be released in the coming days even. But we just want to make sure that we get a good assessment of their neurologic status before we decide that they're ready to get out there.
And this is what we've been seeing, right? So you could have a fully healthy body weight female sea lion come in just as comatose and hard to get out of that sort of stage as one that is 60 kgs and much thinner. What are some of the other reasons that they're not recovering as well as we've seen in the past? Like, what about this bloom? What about their physical states are sort of causing this?
Well, so yeah, some of them have been coming in great body condition, and we associate that with a more acute condition where they've been exposed to the toxin, but relatively recently, so that it hasn't impacted their body condition. They've still been foraging well up until recently. Sometimes when they come in thin, that's a sign that we're dealing with a more chronic condition where they have been exposed to domoic acid for longer, or perhaps repeatedly over years even. And so that body condition is something we look at closely when they first come in. In general, these animals, even if their body condition is good when they come in, they can be really severely affected and be very sick, particularly with this bloom. We've just seen a lot of animals that have been particularly impaired from this toxin. And we don't know if that's because they're just exposed to higher levels or if it's a particularly toxic form that we're dealing with. But it does seem to be quite severe, this bloom.
So what about the fact that a lot of these female patients are pregnant, and what is that doing in terms of their overall health?
Yeah, that's a good point. So adult female sea lions spend, most of their adult lives pregnant. And these ones, many of the ones in care either were pregnant when they arrived or are still pregnant. And the toxin is water soluble and it can actually circulate in the amniotic fluid. So it kind of causes a reinfection or at least a continued exposure to the toxin for the females. It also has developmental impacts on their pups. So one of the main courses of treatment for us for these adult females is actually to induce them to abort their pup, because that allows for them to get rid of more of the toxin and gives them the best chance of recovery.
So an animal that isn't pregnant, what we're trying to do is control the seizures, flush the toxin out of their bodies by giving them nutritional support, hydration support,
Yeah.
and that works, right? When they're pregnant, that doesn't work because of the
There's just
recycling
more
of the toxin.
toxin
So,
hanging out within them.
okay.
Yeah.
So it's really hampering anything that we can do on the front end until that really is corrected for the most part.
Yes, we do the same things with the pregnant ones, but it's not as effective. It doesn't work as well until we are able to get rid of that other factor.
And I know, Madison, you were here in a support role off and on during 2023. But we had animals that were pregnant, but they were giving birth at the same time as this bloom started. So we did have pups born at the center, different presentation of symptoms altogether because it wasn't sort of recirculating. They were either had already given birth or giving birth within a day or 2 or 3 of being admitted to the hospital. These animals, it's not the case. So where the bloom might present similar issues, the different timing of these blooms presents unique challenges. And this is one we don't normally see happening in February, March. And that's part of the challenge, right?
That's right. It's also that the pups are at a different stage of development. You know, they're still developing fetuses, and the ones in 2023 that were in June, they were pretty much fully developed and ready to be born. And we know that this toxin can induce premature labor. And so it's possible that that's what was happening in 2023. But regardless, the pups didn't, the thought was that their development wasn't impaired as much because they had finished developing by the time it had happened. Whereas these pups at this stage of development, they still would ideally be in there until June. And so they're not viable on their own at this point.
Okay, thank you. And I know it takes an emotional toll on everyone, an added emotional toll on top of an already emotional toll when these animals don't make it, the fetuses. And that's something we're dealing with. We won't highlight on that right now, but it is something our staff, volunteers, and people on the beach have seen and are continuing to see. And it hurts a little bit, right? I mean, it hurts a lot of it.
Right. It's hard to see, definitely, but our volunteers have been amazing here in being able to, you know, keep the big picture in mind and recognize that it really is what's best for these adult females, for our patients.
And we'll talk a little bit about some of the research that we're going to be undertaking. One of the things about animals that don't make it is, at least for me, knowing that we're going to learn everything we can of what happened to them, what maybe we could have done differently, what are the environmental factors that we want to advocate for change in, so that that animal passed in service to future animals that are going to need our help. Is that
Yes, exactly. We're collecting samples for research from all of our patients that come in the door, but the ones that don't make it actually allow us to learn the most in many circumstances about this toxin and its effects on developing pups as well as on adults, and what we can do for treatment strategies going forward. So they provide really valuable information.
So can we, Jamie, check in with Dave real quick and see, we're going to move on to the next pool after we check in with Dave on some questions, which is going to be really fun. These are pups. There's a wide variety of species in this pool. It'll be a very good dose of hope and joy refill. But for now, Dave, what questions?
Madison, can you talk about a lot of questions about how we treat them? Like when they come in, we might have gone over this well, but the audio was clicking in and out. So just talk about like what's the process of treatment for a patient that comes in to be it?
Yeah. So what we do generally is, if they're seizing when they come in, we immediately try to give them medications to get their seizures under control. The more seizures they have, the worse their prognosis is in terms of having lasting damage impacting their brain. So we try to get that under control first thing. And then we also try to flush out the toxin. We do that by giving them fluids, both oral fluids. So we use a tube to put through their mouth into their stomach and give a bunch of fluids that way. We also can give fluids by injection underneath their skin, subcutaneous fluids. So we give them a few liters of fluids right when they come in the door. We also give them nutritional support. If they're not eating fish on their own, then we use that tube, the orogastric tube from the mouth into the stomach to give them a fish milkshake, basically, for some nutritional support. That also helps to keep their gastrointestinal tract moving to help flush out the toxin. And then we give them oral medications to control their clinical signs, which primarily are seizures. So we're giving them anti-seizure medications. They're called anti-epileptics, as well as some supportive therapy, an antioxidant, and then kind of treating whatever other signs come up. Some of them, particularly if they're seizing on the beach or rolling around in the surf, they can develop a secondary pneumonia from aspiration or something like that. So we treat whatever else they might have also.
We can show the animals again, but Dave, are there more questions?
There are. We had a bunch of questions about the bloom itself, right? So how does the bloom form? What is pseudonychia? What is domoic acid? And what's causing it all?
So I'm going to say, Dave, why don't you answer that question? That is your specialty.
So I didn't type seal. That's harbor seal. Domoic acid comes from a phytoplankton. So when we look at the ocean, it's not really blue. It's often very green. That green comes from an algae in the ocean called phytoplankton. The particular kind right now produces this toxin called domoic acid. Domoic acid builds up in the food chain, concentrating at each level until it gets into animals like sea lions, seabirds, and dolphin. And that's when the domoic acid, the neurotoxin, starts to affect their brains, their organs, and causing all the problems that Madison was talking about that we need to take care of. Now, unfortunately, the reason why we're seeing this now and 4 years in a row is because we're seeing a shift in what is normal out there. It's a naturally occurring algae, but it only occurred every 3 to 7 years. So periodically, this is the 4th year that we're seeing this bloom. So from last 4 years, we've seen this. It's because of climate change, ocean acidification, and eutrophication of our coastal ocean. A lot of people talk about, well, was there the fires, the LA fires and the runoff from that? Could that have contributed? And runoff contributes to algal blooms, but it doesn't have to be the fire runoff. It could be any runoff that's going to cause a bloom of algae to happen.
So Dave, let's talk about the fire runoff and causal relationship versus contributing relationship.
Right.
Not a causal, right? Because that's upwelling, which hopefully you'll get to in a moment.
Yeah.
But it can contribute to the growth of a bloom that's formed more naturally, correct?
For sure, right? So upwelling is something that happens naturally along our coast, and it's one of the reasons why we have so many magnificent marine mammals out here. We have California sea lions, elephant seals, harbor seals, northern fur seals, all of the whales. They're all here because of the amazing richness and diversity of life out here. We are unfortunately contributing additional nutrients to the ocean through agriculture and urban runoff, including things that come out of the fire retardants and things like that. Yeah. They may have contributed to this, but we don't want to point at just this one thing in one event and saying that's the root cause, because it's not. It's climate change. It's big things that we all have to come together to change. It's not just one thing that we have to handle.
That's a very key point. And Dave, just to make sure we fully explain upwelling for those who might not know. So upwelling it needs wind first, right? So if you think of this as a recipe, right? What are the ingredients? Wind, cold water.
So the wind, so what are the recipe for upwelling? So you need wind that blows actually parallel to the coast. Counterintuitively, water actually flows at 90 degrees to the direction of the wind. Look up Ekman spirals if you want to Google that later. But what it does is it pushes the surface water offshore. The surface water is warm, but the nutrient-rich, deep, cold water below that comes up when these winds blow along our coast. It brings that nutrient up to the surface and sparks that plankton bloom in the base of the food chain. That's why we have all of this life here. So upwelling is a good thing. It's a natural thing. But when we see climate change interacting with patterns of weather and climate, we're going to see shifts in those wind patterns. We're going to see times a year where it's blowing a lot. Sometimes when it's not blowing, the timing of those winds could change. It's climate change. Everything is getting messed around with, and we're seeing the effects of that with these algal blooms.
Yeah, thank you. What is there any other question? And then we should move over to the pups.
Yeah. I think we got a lot of them.
Okay, why don't we move over
Let's
to the
move to
pups,
pups.
and then we'll have another check-in on.
Sorry, you guys are probably hearing the cart move.
Get ready for the space. We all need it at this point. You're seeing Coragio here. That is a young harbor seal pup. So it came in around a month or so. Is that correct, Madison?
A month ago or so.
No, I sorry, at a month old.
Well,
sorry.
Less than that.
A little less than that.
A few 2 or 3 weeks probably. So what normally would have still been with his mom in the wild was a little too early to be weaned, but
so I just want to point out a little elephant seal pup is also joining us at Coragio. So you've got actually three of the species in this pool: a sea lion pup. Sorry, I didn't mean to cut you off, Madison.
That's okay.
Harbor seal pup and an elephant seal pup who's poking his head out of the water right now. Sorry, go ahead, Madison.
Those are the 3 pup species that we have on site now. So
sorry, tell us about Coragio.
Coragio. He, when he first got here, we had to tube feed him to give him nutrition. That way he was not eating on his own. But now, as you can see, he's gained weight well. He's in pretty good body condition, and he's able to eat fish from this big pool and compete with all these other pups. So that's great to see. He's doing well with us.
And then could you show the elephant seal that's on his back on the side to the other side? Do you see him along the fence line there, Jamie? Maybe zoom in. Can you talk? I know Dave loves this topic, but so do you, Madison. Can you talk a little bit about the snot, the elephant seal snot? It's very important.
Yeah, it's very important. So elephant seals are deep divers, and they need their snot basically to be able to keep their lungs and airways open while they're diving. And so they have a lot of it, and it's actually normal for them. It's a healthy snot. If you saw that on a sea lion or other species, it wouldn't be normal, but for elephant seals, that is normal.
Great. Are you capturing, some of them are playing in the water. They just had dinner a little while ago, which is why they're a little tired here, but they're so cute. What is your favorite thing about these animals, Dr. Peters?
I think for the pups, I'm particularly partial to the sea lion pups. And I think the reason for that is because they're so gregarious. You can see them just playing with each other and interacting. They're very social, and they just seem like they have a good time, honestly.
Well, if we're going to talk about who's our favorite, no, we don't have favorites, but I love the little harbor seal pups. They remind me of my cats, a little sassy, all about them and the timing of when they want attention. Harbor seal pups are really cute to watch in that they don't like anyone or anything, even other harbor seals a lot of the time. And so they tend to do this little swatting action with their front flippers when other animals get close to them. But they're very cute, very endearing. And then I'm sure Dave can tell you why elephant seals are probably so amazing, right, Dave?
I can. Oh, we had a question about elephant seals as well. Yeah, so elephant seals are amazing, Amy. That's right, because they are deep diving specialists. They're extremophiles, dare I say, in that they are able to, when they're fully grown, hold their breath for 2 hours, dive a mile deep. And you see those gigantic eyes looking at us right now are all adaptations for living in deep sea. You can also see the vibrissae, the whiskers, or eyebrows that need some taken care of. Those are actually able not just to be tactile, to touch things, but also to feel movement in the water. So they're able to see with their vibrissae underwater almost and detect fishes and things like that swimming around. Now they swim down to these lightless depths, but that means no sunlight. It doesn't mean no light at all. I don't know if you knew this, John, but there's some theories that say that there's a lot of bioluminescent animals in the deep. And when you swim through this deep water, you're lighting up all of these bioluminescent animals. And there are predators, perhaps like elephant seals, that can follow luminescent trails until they get their meal at the end of that trail.
That's pretty cool.
So those big eyes to a place where there's no sunlight, why would they be useful? Maybe they're looking for bioluminescence.
I love that. Dr. Peters, anything you want to add?
And why don't they get DA?
Oh, why don't they get DA?
Oh, they're eating different things than the sea lions are. They're diving deeper and foraging at at deeper levels. So the fish that they're eating are different and are not exposed to the algal toxin as much.
But they could get it. Is that correct?
They could, yes, they could get it. And we don't necessarily know if we don't see it in them because they don't display clinical signs associated with the toxin, or whether they truly don't get it. I think it's probably the former. But another thing is that the ones that we have in care right now are pups, and they all come in very malnourished. They nurse intensively from their moms for a month or so, and then they go into this fasting period where they have to figure out kind of how to be elephant seals, and some of them can't quite figure it out and become really malnourished and end up in our care. And so when they get here, some of them have done some foraging out there, but they really haven't done a lot of it. They haven't eaten that much in the wild before they get to us, at least not the ones that are at this life stage. So they don't have that many opportunities to get DA.
So Madison, there's a lot of questions around releasing animals while there's a bloom off the coast. So I'm going to take a stab at giving my answer to this.
Okay.
And then please tell me if you agree or disagree.
Okay.
It is a very good question, and it's one that I think we ask ourselves a lot. There are risks to animals being in a captive hospital environment. Secondary, tertiary infections or issues that occur. I say a lot of times when these pups are in here, it's like putting 20 kittens in a very small room without a scratching post. They're going to get up to trouble. They want out. They want to be in a natural environment, and they can hurt each other. So we have to weigh the risks against keeping them in a captive state, and also the risks associated with them potentially being exposed to domoic acid. The data that we have from rehab facilities for many, many years shows the risk to be lower for getting exposed to DA than the risk of something happening unintentionally in a captive hospital environment. Is that pretty much correct? Or
yeah, that's exactly correct. The only other thing that I would add is that compared, even though we feel like we have tons of animals here that are being impacted by DA, considering the California sea lion population, it's a relatively small percentage of the population. There are plenty of sea lions out there right now that are not getting exposed to DA and becoming sick. And so it's not to say that releasing them, they'll surely become exposed again.
And let's talk about the population a bit. We don't really know, is it correct, what the effect of these DA blooms every single year is having on the overall population. And for us, each individual animal is why we exist. It contributes to maybe population improvements, but we're really focused on these individual animals while being concerned and wanting to know more about what the health of the population in general is. We don't know a lot about that over the last 4 years. Can you talk a little bit about what some of the gaps are that might contribute to us not really understanding that?
Yeah, well, part of it is just that understanding population level impacts takes some time. And as Steve was mentioning, we've seen blooms every 4 years. Before that, the time scale was different, and the scale of this bloom in particular is different. This is a evolving situation that changes frequently, and we just really, I think no one has had the time to fully get a handle on it. That's not to say that we would never see population impacts in the future, or that we surely will. We just don't know yet. It's too soon to tell, which is one of the reasons why it's important for us while we're treating these animals to be able to gather the data that we can and share that with our other partner organizations within the Stranding Network so that we can compile it all together and see what information we can gain from it on a larger scale.
Great. We're going to go ahead and move to the other side of the hospital. It looks like it should be okay for us to go back there. I'm just looking through the fence at the activity level. So let's go ahead and move there.
That real quick,
yeah.
we did have a question since we were here with the pups. We had a question about, you said all the females are pregnant. And if the pups, can you talk about the prognosis for the pups for these females and
the pups with DA that are in the hospital, or the ones that are here in this pool? Yeah, we did cover that, but the mic might have been out. So do you want to say that again? Yeah.
So
and we can walk and talk. Yeah.
These pups were born, the ones that you're seeing in this pen right now, that are in care, they've been in care primarily for malnutrition. They were born last June. So they are almost a year old, whereas the pups that these pregnant adult females are aborting in our hospital, they're premature. They would be normally born this June. And so at this point, it's like having, you know, a very premature baby. They're not viable on their own. Their moms also are not in a position to take care of them. And if they were to continue on in their gestation because of their exposure to the toxin, it is possible that they can have, we call it developmental DA, which is they can actually show neurologic signs as a result of being exposed in utero.
And it can pass the placenta as well as be in the milk.
Yes, correct.
Give us a moment to reposition.
Sorry for the noise of the cart moving.
Jimmy, maybe get over in here. So Jimmy, if you want to just move over into this pen here, pen 2. I'll let you get the camera settled. So what you're seeing here is one of our largest dry pen spaces. So animals that we just don't want to be in a pool for various reasons, especially with these DA animals, are housed in a dry pen. I think, Madison, you could talk a little bit about why it's okay for them to not be in water all the time, for those who have that question. But also, these are animals that are still in that more comatose state or seizing state. So we talk a little bit about what people are seeing in this pen and what these animals are experiencing.
Yeah, so as you can see, some of these animals are, you know, active, aware, moving around a bit, but many of them are sleeping or pretty down. And so we can fit many of them in here together. And this is right in front of our main hospital area. We're able to keep a close eye on them to administer medications as necessary if we see them seizing. And then these animals also are in a state where they're not, most of them are not eating on their own at this point. So being able to just keep them here front and center, these are our most critical patients. And so we can keep an eye on them. And these are the ones that are getting more frequent treatments.
And then we have a triage area in our parking lot that was set up to allow us to bring more animals into care. If we were looking at the parking lot, which we're not going to be able to go out to, it's going to look similar to this, right?
Yes.
And those animals similar in terms of their current state of what we're seeing here?
Yes. Yeah, we try to keep them while they're in that that quieter state. We try to keep them in pens like this so that we can keep an eye on them and give treatments more easily. When they start to wake up and become more active and even become kind of move into that more aggressive state, it just, we have to move them out of a pen like this because it's logistically too complicated to care for them when they're in a big space like this. But for now, for all these animals, it's okay for them to just be together. And then again, front and center in our hospital so we can keep a close eye on them.
So we're going to stay focused here for just another moment or two. But if you went to the left of us and you went a little back from us, you're going to see animals similar to this, just in smaller enclosures, right? So this is part of the overall population of animals on site right now, but there's areas to the left that people can't see. So just giving a little sense of the scope and scale on site at the moment.
Yes, we have several other pens with animals that are in this state. We also have some other pens that have animals that kind of look more similar to the ones you saw first in the pools. But we only have so many pools for them to be in, so we have them in other pens as well.
And with these animals, we would not necessarily trust that they wouldn't seize and possibly drown in a pool at the stage that they're in now, right? I mean,
correct. Yeah, these animals are not pool eligible at this time.
Yes, okay. And hopefully we've got competition with barking, so hopefully you're able to hear over that. We could also just be quiet and let you enjoy the sounds of these wonderful animals, which we'll do for a moment while Dave catches up on some questions.
So we had a couple questions about habituation and the danger of that. Do you want to, like, from a more technical standpoint of me saying we try to be as hands off as possible? How do we control for habituation? We want to see that.
Yeah. No, habituation is something we think about all the time. We really want to prevent it. This is again an unnatural environment for them. But to some extent, we do have to handle them to administer treatments and everything. So some ways that we mitigate that is we try to minimize our speaking around the animals. We avoid eye contact and things like that. And we also use these wooden herding boards, both for our own protection when we go in the pen to be able to move animals around and protect ourselves from them, but also because it just breaks up the human silhouette a little bit and hides us from them a bit, which is also important just to try to minimize their association of, food with people and just general human interaction. We try to avoid that as much as possible.
So Madison, there's a couple questions I see in there about dolphins, and it's not just sea lions that we are treating or responding to. There are dolphins, and it looks like whales might be included in this as well. So could you talk a little bit about what we see with dolphins? And it's really a mortality event, correct, with them? And then what we're seeing and concerned with when it comes to whales.
Yeah, so cetaceans, dolphins and whales are different when it comes to stranding in general. Particularly in this area, when a dolphin ends up on the beach, it is already in really bad shape. It takes a lot for a dolphin to end up on a beach. They don't haul out normally the way sea lions do. And so they are really in bad shape by the time they end up on a beach. The species of dolphin that we're seeing strand associated with this bloom, common dolphins, they also they're not good candidates for rehabilitation. They're very difficult to rehabilitate. They get stressed out and they just don't tend to do very well. So for the dolphins that have stranded during this event, we have decided that euthanasia is the best thing we can do for them. And so we've been going out to the beach whenever a live dolphin strands on the beach to be able to euthanize them there. We want to minimize their stress as much as possible and reduce the amount of time they have to spend on the beach, but also we don't want to have to transport them here for euthanasia. It's just better for them if we can euthanize them right where they're at. And unfortunately, many of them are just washing up dead or dying shortly after they end up on the beach, even sometimes before we can euthanize them, which just goes to show how sick they are by the time they're stranding.
And Madison, just to bring the point closer to home on their sort of prognosis, they suffer from cardiomyopathy and capture myopathy, and part of it's not just poor candidates for rehab, it's very low success when it is actually tried. And involves a tremendous amount of resources of people having to basically move the animal through a pool 24/7, and then still their outcomes are really poor. So it's really the only humane option that we know of, especially for an animal that's got domoic acid on top of whatever else may have contributed to its stranding. Is that a fair thing to say?
That's correct. Yeah, we really can't treat domoic acid in these animals. So euthanasia is yeah, you're right. It's the only option.
Yeah. I just thought it was important for people to understand that it's not just a lack of resources that are stopping us from sort of treating or rehabbing them. It's really more complicated than that. And the success rate is so low that it's really done more for endangered or threatened species, and at least the attempts, if that's correct, right?
Yeah, or certainly animals that are not stranding for a severe disease process like this one.
Okay, thank you. Dave, anything else that people are asking about that we could cover before we move on to some Ellies? Even though everyone's quiet.
Yeah, we had a few questions that I was answering individual questions, but I didn't repeat the question. So in the pen that we have right here, these are mostly female Californians. They're all California females. They're all mature animals, so mostly 5+ years old. They can get to be about 20+ years old. We don't have any males in here for a couple of reasons. One, we have mostly females. So most of the space we have is going to taken care of. They could potentially have a mating interaction or something like that we don't want to have here too, right?
Yes. Yeah.
And that the female probably doesn't want to.
Yeah, right.
Exactly. It's easier to keep them separate at this point, but we also, the vast majority of our patients right now are adult females.
Yeah. All right. Madison, could you talk a little bit about releasing an animal after treatment with domoic acid is not as simple as releasing an animal after treating for domoic acid. There's some behavioral assessments that have to be made and some risks about their ability to survive, but also their ability to not endanger the public. Can you talk a little bit about the struggles with this particular decision and what you're looking for in order to do that?
Yeah, it's a really hard decision. We're trying to do neurologic assessments on these animals in a unnatural environment for them.
And without an MRI.
Yes, yes. And it's difficult to assess their behavior in a place like this where they're not behaving normally, they're not in their natural environment. And then in general, the reason why we're assessing their behavior rather than relying on advanced imaging, as John mentioned, MRI, is because it's just not feasible for us to MRI every patient. What that would show us is it would help us determine whether their exposure to domoic acid is more likely to be acute as opposed to chronic. And if it's chronic and there's permanent brain damage that they have, which you can see on an MRI, then they're not going to be able to thrive in the wild. We have data to tell us that those animals that are released after chronic exposure aren't able to forage. They end up just unfortunately starving slowly, or they have seizures in the water and pass away that way. And so we really want to prevent releasing animals that we don't think are in a position to thrive in the wild. And so that's why we spend a lot of time trying to assess their behavior while they're in care. That being said, it's a difficult assessment to make, partially because of the environment, but partially just because the tools that we use to assess neurologic status in sea lions or in animals in general, really, as opposed to people, it's just challenging in animals that can't participate in their own care the way that, say, humans can.
So overall, this bloom is much worse on the animals in terms of even just their overall health outcomes than even what we saw in 2023. Is that correct? I mean, we're just seeing some animals struggle and not make it.
Yeah, some of these animals that you see in this pen have actually been in care for some time, even a couple of weeks, and kind of just remained in this more comatose state instead of popping up and becoming more active relatively quickly, which is what we aim for and what we've seen more often in the past. We are feeling like with this bloom, some of them just are not getting better as quickly, if at all.
Well, as we wrap up, I don't want to leave it on that note. So why don't we go around the corner
check out some
and see some of our Ellies. This is elephant pup stranding season, if you will. Dave, why is that?
Why is it elephant pup stranding season? We're running over our cord here. So we see an annual cycle of stranding that's associated with the breeding cycles of these animals. So with elephant seals, they're born in December or January, and they nurse with mom for about a month. So they'll go from being born at like 75 pounds, right?
Yeah.
And then they'll drink mom's milk, which can be 30 to 50% fat. They'll balloon up to be 300 pounds. And then they're on their own. Mom takes off. They're weaned at that point, and they are ready to be wild after hanging out for a little bit.
So we want you to be able to hear.
Oh, yeah, they'll be able to hear.
Oh,
Can you guys hear that?
are you guys hearing it?
Oh yeah, and the markings on their head. Okay, so they go out on their own. They're wild for the first time. Not all of them are going to be able to find enough to eat, and they're going to strand because of that. And so that's the stranding season with these pups. So all of these guys that you're seeing right now are only a few months old.
I think maybe Dave let them speak.
Yeah, right. Probably they're saying
so we'll just let them speak for a moment.
Probably a good idea. What are on their heads? This is how we tell them apart. So each animal gets a unique color code in grease marker on their head, in addition to their flipper tags and their Pharrell markings. It's just all the different ways that we're able to identify individual animals, because every individual animal is an individual patient on its own path to recovery, with its own chart, medical records. We know each one as an individual.
Okay, so you brought up a word, Pharrell marking, that you now need to describe what that is.
Yeah, we can. One of the reasons why we put the marks on their heads is because they're not easy to see on an elephant seal. But the Pharrell marking is a shave mark that we
saw the sea lions.
Right, you probably did see that on the sea lions. We use just a regular clippers to shave straight line markings on the sides of the animals that are referencing numbers, so that they can we can identify those individuals from a distance. So the Pharrell marking is a marking system that we can use to be able to identify the animals. Oh, it's not scarring on them right now. You're seeing fat rolls, fur, and the difference between wet and dry fur.
You're also seeing animals that are way underweight for what they should be or what they would be if they were in the wild. So about
skin rolls, not
4 or 5 times thinner than what they would be if they were healthy in the wild. So these animals, where they look like large pups, they are really much smaller than they should be. So they're here to eat. Eat and eat and eat is really the name of the game. And they'll go through a lot of hair, a lot of pounds of fish, which they are doing so now. So in addition to all of the animals stranded with domoic acid, we're starting to see more and more elephant seals here. And last year, I think we had 60 or 70.
Yeah.
We're at around 25 of them or 20 of them so far. So hopefully it's not as many as it was last year, but we're going to do our best to keep all of them if we need to.
John, do you want to do my favorite fun fact about the noises?
For those who love the Lord of the Rings, the orcs, if it sounds familiar, it's because it's the sound of elephant seals that you hear when you see the orcs in Lord of the Rings.
That's what it is. How much money does it take to feed an elephant seal pup?
A lot.
A lot. So we spend, we buy 150,000 pounds of food.
It was 170,000 pounds of herring to start the year. We were able to secure another 50,000 pounds at the same price, thank goodness, before tariffs hit, because we get all of our fish from Canada. Yeah. Because with the influx of additional animals, we needed more fish. So we're at about 230,000 pounds of fish for the year. This elephant seal pup, they'll be here for 3 months. And I think Madison, how many pounds will they go through when they're free feeding a day? An elephant seal pup? Is it 15? So 15 pounds per elephant seal per day for 3 months. That's why I said a lot, because I don't have my calculator in front of me. And it's about $1.30 a pound of fish.
So it's our single largest line item outside of staffing, right?
Correct.
I feel like we're yelling.
I know. Well, we were trying to yell over elephant seals, which is never easy to do. Are there any other questions? I know it's getting close to 7 o'clock. One thing I'd love for everyone to do is, we haven't done this before in this way. Would love for feedback on how the video was, the audio, the questions.
Yeah, we got
Too
feedback on
much-
the audio.
Yeah, the audio. Okay, well, the audio after the fix. Or anything else that you'd like to see or experience through a virtual setting. We also invite everyone to visit us in person, of course, and know that not everyone can or doesn't live close. But please let us know if you have any suggestions for topics like this or ways to bring the experience to you all.
Hey, watching from Queensland, Australia. Thanks for joining us.
Ah, that's awesome.
Oh, rescue stories. That's a great idea.
Oh, very good. We could do that for sure. Any other parting thoughts, Dr. Peters and Jamie? I know I'm going to pull you away with the camera because we need to wrap up. So maybe I know it's not going to be popular, but
I'm going to try to bring the
maybe you can
laptop
focus
closer to
on- Says we say goodbye and thank you. But any other things you'd like to share just about how all of this is, what's it like dealing with it, or what the team needs or is going through?
Yeah, you know, the last couple months have been crazy for us here, but we have an awesome team that is super dedicated to caring for these animals, and they've been amazingly resilient through this process. Our volunteers as well, we really couldn't do any of this without them. And of course, you guys are supporting us. We really couldn't do any of that. So thank you very much.
Can you, Jamie, that's Brad over there in the truck. We're doing a live stream, Brad. Brad was constantly rescuing animals all day today. Brought two in just about an hour ago, many more earlier in the day. So thank you, Brad. If you see Brad on the beach in one of our trucks, please wave hello. Dave, anything you'd like to say before we end?
Just thank you to everybody. Thanks for the feedback. Yeah, we're happy to do more of these. Given time, we have a lot of work on our plate right now to care for all of these animals, but we can do stuff like this in the future. We'll work on the audio as always. But thank you all for participating. So generous, over $1,300 in donations just through this, which is great. We appreciate it. And we'd love for you guys to continue to follow us, continue to share with your friends and colleagues, because that's really what we want. We want people to know about what's happening and to spread the word.
Just thank you again for joining us, for all of the support. And, you know, it's Earth Day next week, which we would prefer it being every day. One thing I want to leave you with is everything you saw here today can be fixed. The ocean can be a healthy environment. Again, if we use our voices, let's remember that our voices are powerful. They're powerful individually. They're powerful even more so collectively. And there is no better time in recent history to use those voices to communicate what's important to us. So please do that. Join us in that. We thank you and look forward to seeing you soon.
Thanks, everybody.